Let's talk about consultation notes. Now, I've worked with hundreds of GPs, and the majority of them do not write notes that would pass muster as far as APRA is concerned. Now, this is one example that would be called insufficient clinical input. Why does this happen? It's because the surgery fills up early in the morning with patients, and you as their GP want to spend as much time with them for them to be satisfied that you have looked after their health. And sometimes this means spending longer with them than their appointment block. Now, to be able to catch up for the day, sometimes the only way is to write less notes than APRA would expect. So what does APRA expect? You can read about this online on the APRA website. Your notes should be clear and accurate, up to date, legible, contemporaneous, respectful, and I suppose these notes tick all of those boxes, but what they don't tick are relevant details of clinical history, clinical findings, investigations, information given to patient, and most certainly they're not sufficient to facilitate continuity of patient care. So how can I help? Now, I'm going to take the role of medical scribe and see if there's not something that I can do about this. Now, I have no training in general practice, but still maybe there's something I can do to help. Now, let's start with a clinical history. Now, I'll go back into the patient's visit history to see what we have. I see that they've been to me 2 weeks ago complaining of back pain, and 1 week ago complaining of back pain and urti. So let's chuck that into the notes. Now, what else has happened? Okay, let's check correspondence in. Fabulous. We've got a fax from our radiology provider of a chest and thoracic spine x-ray for the patient. And there's a nice summary here. So let's chuck that into the notes. Now, what else do we have? We've got an investigation report from our pathology provider of detection of bacterial DNA via throat swab. So let's put that into the notes as well. Okay, now we have this relevant clinical history for the patient. What else happened during the consultation? Well, I can see that the doctor prescribed oxycodone, presumably for the patient's back pain. Now, I haven't worked with a GP who would not warn their patients about the risks associated with prescribing opiates, specifically for dependence. Oftentimes, doctors would not write this into their notes. So let's help the doctor out by putting a warning about the risks of dependence for the patient. What else happened? The doctor prescribed Augmentin, and Augmentin is a second-line antibiotic and should only be used in cases where the patient may be resistant to regular amoxicillin, and this has to be documented. Let's put that into the notes as well. Okay, now I have added a lot more detail into these notes, and they are much more APRA compliant. And again, I've done it as a medical scribe. Now, I've written some software called Scribe, which does all of this for you without you having to think about it at all. It adds all of these prompts for the patient's history for you, and it will post-process your notes to make sure all of the information is there so that you don't have notes in your record which may bring the risk of audit. Now, what else can Scribe do? Well, I've noticed as a medical scribe that this patient has no allergies set, so I will prompt the doctor for allergies to be set. Now, I will also remove this prompt from the doctor's notes if it's still there at the end of the consultation. Another thing I'll do is that I've noticed that this patient is Aboriginal, and I'll look into the patient's billing history and find that they haven't had a health assessment. So why not prompt the doctor? And again, I'll remove this after the consultation is finished. So how can you start using Scribe tomorrow? Well, it's very simple. You just need to be a member of GP Clarity. It takes a few clicks to install it at your practice. We just log in, and your practice manager will have access to this screen where they can set you up with one click. Just hit this button and this doctor will start using Scribe from tomorrow on. Now, another neat thing is that you can set up your Scribe preferences on here. So if we don't want to use the default settings, we'll go through a detailed list of different options that are available to you. So yes, we want a history. We want the history to go back 3 months. I want very verbose pathology results. Yes, I want to show normal results, etc. There's a lot of options available in here for you to get the most out of Scribe. If you're a GP with your own login to GP Clarity, I'll show you what that looks like. So we're at your compliance report. We go to the left bar here to settings, go to guided setup. I would like to modify my Scribe settings. Would I like default settings? Yes. Okay. There, we're ready to go for tomorrow. And that's all there is to it. You will start to get pre-filled and post-processed notes from tomorrow on.